Did your ENT surgeon tell you that your ear infection has spread to the bones? Or you might have been diagnosed with a scary term called cholesteatoma, and your ear has become unsafe now. Now you have to undergo a surgery called mastoidectomy. Hi, this is Dr. Debayan Tarafdar. I am an ENT and head neck surgeon working in Kolkata, and welcome back to the video series Ear Surgery Explained. In the previous video, I have discussed about tympanoplasty. In this video, we are going to dive deeper about mastoidectomy. Before jumping into the surgical process, let us understand the anatomy first. Touch the bulge of bone behind the ear. This is the mastoid bone. It might feel solid from outside, but it is actually like a honeycomb. It has air-filled pockets. This mastoid bone communicates with the middle ear. If you have seen my previous video on tympanoplasty, I have compared the eardrum with the front door of the house and the middle ear as the living room. Now think of mastoid as the attic or the storage space. Now if there is a hole in the front door, dust and water and dirt not only enters the living room, it can also enter the attic or the storeroom. Now merely patching the front door does not take away the rot from the attic. Now coming back to mastoidectomy. Mastoid is the name of the bone. Ectomy means to remove. In mastoidectomy, we remove the rot from the mastoid bone. Think of it like deep cleaning your attic or storage space. There are mainly two conditions where we do mastoidectomy. One, chronic mastoiditis. In this, there is a perforation in the eardrum, which has not only caused infection in the middle ear, the infection has spread beyond the middle ear and traveled into the mastoid bone. Secondly, cholesteatoma. Now, cholesteatoma is a skin-lined cyst that has the property to damage or erode bone. Because of its bone-eroding properties, it can cause significant damage to the nearby structures like facial nerve or bony labyrinth. Even it can erode the bone between the ear and the brain. Hence, it can give rise to meningitis, even brain abscess. That's why it is often called unsafe COM or unsafe chronic otitis media. Similar to tympanoplasty, this surgery can also be done by mainly two approaches, postoral and endoral. You can refer to the previous video for details. In very limited mastoid disease, we can also use an endoscopic approach. This surgery is almost always done under general anesthesia. In this surgery, we used a very specialized drill to drill out the rotten bone and dirt from the mastoid. In case of cholesteatoma, we remove it in total. Our main target is to make a wide open mastoid cavity so that it becomes one with the middle ear and there is no hidden space for any infection to thrive. Often this surgery is done along with tympanoplasty where we patch the eardrum as well. Then it is called tympanomastoidectomy. So what are the complications of mastoid surgery? Now theoretically it has more chances of complication than tympanoplasty. But in expert hands and with good instruments, chances of complications are minimal. All the risks and complications that I have discussed in my previous video applies to mastoidectomy as well. To add to it, there are two main things we should be concerned about. One, damage to the facial nerve. Because the facial nerve runs along the middle ear, there is a chance that drill or other instruments can hit the facial nerve and damage it, especially when cholesteatoma or the mastoid disease has already eroded the bony covering of the facial nerve. 2. Permanent hearing loss. Because the instrumentation and drilling is happening very close to the stapes bone, it can cause injury to the foot plate and can cause permanent hearing loss. Thanks to cutting-edge nerve monitors and great microscopes, nowadays complications are extremely rare. So how will you feel after the surgery? Recovery process is very similar to tympanoplasty. You will have a bandage which will be removed after 4 to 5 days. Then you will have similar restrictions that I have already mentioned in my tympanoplasty video. One very important thing that you have to remember as a patient that after every mastoid surgery, it is utmost necessary to periodically visit your ENT surgeon for checkups and regular cleaning of the mastoid cavity. So mastoidectomy is a wonderful and essential procedure to make your unsafe ear safe again. Hopefully this video has cleared off most of your doubts. If you still have any questions, please write it down in the comments below. If you like this video, please share it with your loved ones. Please subscribe to the channel, that helps a lot. This is Dr. Debayan Tarafdar. Stay healthy and I'll see you in the next video.